So I did the Anderson Fellow in Public Affairs, and at the National Association of Chain Drug Stores, NACDS for short, I spent most of my time in Alexandria, Virginia, but I also spent a great deal of my time in Washington, D.C. To give you a little bit of an organizational overview, NACDS has its lobbying arm, which is its association, and also a foundation arm, which is its charitable giving. NACDS represents about 38,000 pharmacies, 114,000 pharmacists, 2.3 billion prescriptions annually, and NACDS members together bring in about $700 billion in annual sales. And on the screen are some examples of NACDS members that you might be familiar with. When I was on NACDS, I worked mainly with a pharmacy team, and they were the Pharmacy Care and Patient Advocacy Department, as well as the NACDS Foundation. And that pictures are the people I worked with on a day-to-day basis while I was there, and below is during my visit to the real Mount Vernon, home of George Washington, with some of the pharmacy interns in the area. Public affairs and pharmacy can mean a lot of things. I worked with many different departments when I was there, and I think that gave me a better understanding of what NACDS is all about. I completed a management training and from the American Society of Association Executives. And I also work with the communication department a little bit, and I was involved in the press release when the ACA was passed. It was a very interesting first day for me. And I work with government affairs, and I attended congressional hearings and policy meetings, which I think provided me a good background knowledge on what's been going on in the industry, as well as the interaction between pharmacy and policy. And I think that it gave more meaning and perspective to the public health initiative work I did with the Pharmacy Care and Patient Advocacy Department. And with the NACDS Foundation, I did things like drafted a newsletter and researched and implemented some of their grant programs. Some of the projects that I think are worth noting, the bigger projects that I did, was that one of them is the Million Hearts campaign, which was a 35,000 grant program conducted by the NACDS Foundation in conjunction with the efforts of U.S. Department of Health and Human Services and Centers for Medicare and Medicaid. And I was involved in the implementation of creating the structures, creating the criteria, the marketing, and the selection process, as well as maintaining communications with grant applicants and recipients. And I also was able to utilize my human resources experiences and interests in a specialized HR research project on the Sabbatical Faculty Fellowship Program. They wanted me to look at all aspects of the possibility of having a faculty on site, and I used those findings to create a possible structure for a program like that at NACDS Foundation. And I worked with HR, I worked with legal, and I also was able to work with faculty members who have completed similar programs in other organizations. And the highlight of my fellowship is really the Pharmacy and Technology Conference. I worked a lot with their education sessions, and since I was highly involved in the preparation of the conference, I was fortunate enough to be the very first Anderson Fellow to be invited to attend the conference in Denver, Colorado. I think it was the best way to wrap up my fellowship. I was able to see all the work that my team and I did all throughout the summer to come together and receive feedback from our members. And on the bottom corner here is a photo of me with Steve Anderson, the president and CEO of NACDS. And up there in the middle is the NACDS chairman, who is also the CEO of Walgreens. And I had the opportunity to meet him backstage right before his opening speech there. Like I said, it was a great experience, and it has definitely impacted my career plans for the future. It has honed my professional skills, some are listed above, and I have a growing interest and a growing understanding of healthcare administration, especially in regards to pharmacy. And meeting people in the DC area and as well as in Denver has provided me with an extensive network of professionals that I can reach out to, and I have reached out to in the middle of my job search for possible opportunities after graduation. This opportunity would not have been possible. I have a lot of people to thank. Steve Anderson, who I mentioned is the CEO of NACDS, also my fellowship donor, and also part of the Cornell College class of 1975. And Kathleen Yeager for hosting me and mentoring me throughout my fellowship, and Alex Adams, who's a direct supervisor of mine, and to this day still provides me with guidance in regards to my career development. And the rest of NACDS staff, and of course, Cornell to thank for. Thank you.